James Clark. Title of my project is AI and Medication in Healthcare, and this is for CST 703. Here's my agenda: the introduction, literature review, methodology, results, and my conclusion. Let's jump right into it. Introduction. The title of my thesis was Is AI Beneficial to Healthcare? What exactly is AI? AI is short for artificial intelligence, which is basically intelligence demonstrated by machines as opposed to a human beings or animals' thoughts. It helps prevent stuff, predict the future, stuff like that. Why is this topic important to me? Because just think about it. Imagine in the 1850s, early 1900s, how was people preventing healthcare? How did they know something was in their system? Back in 1950, when AI started coming around, it was from a man by the name of Dr. Alan Turing. He questioned how can we outsmart humans by saying how can we prevent certain stuff? How can we predict the future? How can we prevent the rain? How can we prevent healthcare? And that's when AI started first coming to the picture. Next slide, please. Okay, there's your review. AI is predicting diseases ahead of time. Here's an example. AI has the capability of if you come into the hospital, you have a particular cough, AI will know what type of disease you may have or you may be coming down with. If you come in there trying to with a fever, AI or prediction of AI and the machines that the hospital uses, they have the knowledge to know what you have going on or how to prevent it, what the next step should be. The next point I want to talk about is how we're spending less money on machines in healthcare due to AI. I'm saying this because imagine you're going to the hospital, you have a headache and a fever of 125. With the possibility and probability of AI, how important it is, it could tell you how much a diagnosis you're using. Say, for instance, you may need to take 10 pills to help the fever or cold go away. Before AI, somebody could order 20 pills and you'll be saving money if you have that 10. Third point I want to talk about is the business model in the healthcare industry, which has been changing over the last few years. Since the early 1990s, healthcare within AI has been increasing tremendously, from the price care to the patient's healthcare increasing as well, preventing different diseases such as cancer, Parkinson's disease, high blood pressure, obesity. All that has become the freaking AI and tools such as that. The next thing I'm talking about is the methodology, what made me come towards this conclusion. Okay, defining and discovering a research question. My research question was, is AI beneficial to healthcare? My hypothesis was yes, I do 100% believe that AI is very beneficial to healthcare. It is the way we should go to help prevent certain things, not just in healthcare, but in life. The next step was developing a research protocol. The next step was finding databases and case studies. I was able to find about 10 to 12 databases within the ANT's database, which was very beneficial. And I found some case studies that were very beneficial as well. My last step was to critically analyze, discuss, and identify a future research agenda. My future research agendas will be how can AI get better? What's the future of haircut within AI? Will there be another AI coming in the future that's better than AI? Or maybe what would happen if AI is wiped away? What would be the next step? Here's my research from my research. The healthcare industry continues to grow as AI technology becomes more popular. It's about currently 9% of the hospitals in the world are using AI. That has been a tremendously increase since the early 1975s when AI healthcare started coming around. Insider Intelligence reports that the spend of an AI is projected to grow over 40% by the time 2020 gets here, which is amazing. And I 100% support this because as AI increases within healthcare, that means your loved ones become more healthy, more safer. You're saving more money when you purchase um, pills, medicine that helps with your loved ones, stuff like that. As per Insider Intelligence, 30% of medical care costs are related within mechanical undertaking. Okay, On the right side, you know it's a chart. As you see from the year 2016, projected growth to the 2020 is a tremendous increase, which shows you that AI healthcare is going up. From a software aspect to a hardware aspect to even a service aspect, everything is increasing. How AI impacted during COVID-19. This was very good research that I found that showed that AI helped out COVID-19. Imagine when the first COVID-19 came in. What was this disease that nobody could figure out what it was? With the power of AI, COVID-19 was discovered. And as AI continues increasing in healthcare, as you go to the different hospitals and stuff, Walgreens, CVS, and you're getting tested with COVID-19, AI is used to determine if you're negative or positive, or you have signs of it. That's why AI is so important. AI tools can also help prevent virus transmission change and monitor broader economic impacts. In several cases, AI technology has demonstrated their potential to interfere more data rapidly than the traditional reporting of health data. With that being said, this shows that if you use AI in healthcare, you're 100% more effective to get a better understanding if you're going through your body between machine than human being. When AI was increasing, they noticed that the impact of AI had patients waiting low as a few hours or a few days waiting on AI discovery rather than waiting a few weeks or months from a human aspect. Next slide. My conclusion. Based on the research and studies, AI has proven to increase healthcare over the years. With that being said, imagine healthcare in the future and how AI will impact that. This paper also shows how AI helps prevent diseases as well, or stuff of that nature. Thank you so much. I hope you enjoyed my presentation. Thank you.